purpose to be carefree. So, friends, enjoy the freedom, have fun, and stay free.
Menopause, according to me, is a new beginning, a wonderful journey awaiting a woman.
Menopause is the beginning of a new life, a time to reclaim your body and listen to its deeper wisdom.
Menopause for me was hot flushes, night sweat, and a lot of muscle and joint pains.
Menopause, a natural part of life, yet one of the most misunderstood and least talked about phases in our lives. In this episode, we're turning up the volume on this, a topic that deserves to be heard. From hot flashes to hormone changes, mood swings to midnight cravings, we are diving into the real stories, the science, and the support that every woman deserves.
This is Life Tray, and today we break the silence on menopause. Let's get real, let's get loud, and let's make menopause a normal part of the conversation.
And later on this show, we have an expert who will be shedding some more light on the topic. But first, our own stories. Madhu, would you like to start?
Yeah, of course. I'm a little embarrassed because till last week, when we started talking about this episode, I thought I got my menopause when I got a partial hysterectomy done. And thanks to all the laughter from you guys and whatever I learned from you too, I can't believe today how ignorant and stupid I was till last week. At 41, I had my uterus removed due to fibroids that messed up my whole health, messed up my whole life. The month after that, when the period date came and went by, I realized I was never going to get periods again. I took out my friends to celebrate. I bought myself a new pair of white pants, and then I announced to everyone that I had got my menopause. Since I speak with a lot of confidence, nobody ever questioned it.
Madhu.
But today you might laugh all you want. But in hindsight, I think though it was a celebration of freedom for me, but today I realize it was a misunderstanding of what menopause really means.
Absolutely, Madhu. I know we laughed, but this is also testament to the fact that there's not much discussion on menopause, right? And
Mhm.
as for me, you to know how I had been suffering for years ever since I got my first period. The severe cramps, the PMS, the migraines, it was just unbearable. So when I finally underwent a hysterectomy, it felt incredibly liberating, if I can say that. Like I had been handed a second life. I can't even begin to explain the relief that I felt. And of course, menopause in its full form came a few years later. But that moment, that freedom from this monthly suffering, it was life changing. I didn't just lose my periods, I regained control over my life. But I wish I was more informed and prepared for what was coming with that liberation.
you know, Talking about that, I remember my niece told me after I had my hysterectomy that can you please convince my mom to get me a hysterectomy also because I don't want periods either.
Oh my God.
Well, I can add to that, since I was having these cramps and all, I had even asked a few doctors if I can get my uterus removed long before I actually got it removed.
See, you know, uh, I mean, it may be painful, but as long as we ladies we get this our menstrual cycle, this is just like a protecting shield for all of us.
Right, very
That
well.
is true.
So you too had a similar kind of premenopausal situation. I want to talk about something different. What I went through during menopause is a little bit different. Like when I look back, I get a feeling that I should have been more cautious during this phase and before some few years before it also. So when I was nearing perimenopause, I focused a lot on physical exercise, but I did not eat the right thing. And then there was a sudden rise in weight. Already I was in the heavier side. So I feel I should have taken care of it immediately, but it took me a long time to understand that my metabolism was not as before. So rigorous exercise was no longer enough for me to shed some kilos.
Absolutely, I agree with that.
Right.
For me, except the hot flashes and the major mood swings, which also could be because I had a small child at the time. I actually cannot remember anything else. Yeah. Okay. So I do have. I've had psoriasis, joint pain, muscle pain, and neurological problems, which came up at around the same time. But then I was just going through each disease or each ailment on its own, and never tying them up together to find out if there was any correlation. Sangeeta, you remember me talking to you about that?
Yeah, right, right. That also I remember, Madhu. So for me, I feel bloating became the new normal, and I struggle a lot to keep up to my fitness level. The worst part was there were so many yoga poses that I was able to do effortlessly earlier. I couldn't do that anymore because my body was not supporting it. My sleep pattern also started getting affected, and I felt very lethargic. It took a while for me to understand that it's all because now my body was transitioning to a new phase and I have to accept it.
Yes, and what a new face, Sangeeta, right?
Yeah.
So many changes. In fact, I noticed pigmentation under my left eye, which was less at first, but slowly it has become quite pronounced now. And of course, the hot flashes are common to all of us.
Right.
Uh, in fact, I would have hot flashes followed by sudden chills, alternating. So one moment I want the AC on, and the next moment I am looking for a blanket.
I can I can so remember those days. But today when we think about all those symptoms and the days of perimenopause and menopause, we can laugh about all this. But I do remember how painful that entire transitioning phase was and how tough it is to navigate menopause even now at this age. So since we are not the experts, let's hear from an expert. Namrata, what do you say?
Yeah, sure. Let's call in the expert. Joining us today is Dr. Preet, Professor and Unit Chief at Sri Ramchandra Institute of Higher Education and Research, Chennai. Dr. Preet is a highly respected and published obstetrician and gynecologist who will help us separate facts from fiction and guide us on how to navigate menopause with confidence. Welcome, Dr. Preet.
Welcome.
Thank you, Namrata. Thank you.
Come, Dr. Preet.
Hi, dear.
Well, Dr. Preet, we have so many questions for ourselves as well as for all the women who are listening to us and who all are going through this transition. My first question is the most basic one. What is menopause and what happens in the body and does it affect differently to different women?
Now, the word menopause, as you know, the word meno means periods and pause means stop. So, when a female stops the menses for a period of 12 months or more, in around the age of 40 and above, it is called as menopause. Now, coming to your question, what happens to the body? Our body, from the beginning, that is menarche, that is the first cycle which we have, till menopause, that is when the period stops, is dependent on a hormone called estrogen. That estrogen is a female hormone. Just remember the name estrogen, female hormone. So, this hormone is very, very important for our body. Okay, it is secreted by the ovaries, that is the female reproductive organ. Now, what happens in menopause is the number of eggs a female has is determined by birth. By birth, you will have a number of eggs, and this doesn't change. It goes in families, and it goes by genetic factors and so many factors. So when the female stops producing these eggs and stop producing the hormones, then there is permanent stoppage of the cycle, and that is called the menopause or stoppage of menstruation. So when this hormone, which is required for a body and maintains all the organs right from the head to toe, all the organs are dependent on this hormone, and suddenly it stops in the body, though it goes through a slow phase of decline. But what happens, it causes a lot of changes in the body: hormonal changes, menstrual changes, physical changes, emotional and mental changes, and lot of weight changes also it causes. So it affects different women differently, and not the same thing for all the women. And we have certain something called, how do we know what it depends on, how it affects? It depends upon the age of the at which her menopause comes and the severity of the symptoms. different ethnic people. Like in the West, the menopause age is 51. For us, the Indian standard is 45. And it changes, it varies from person to person. And then I went through a PubMed article which said that Orissa people tend to have a menopause still earlier. By 45, most of them have menopause compared to other states. And the lifestyle manifestation, like smoking, if somebody is having, or somebody is having a high BMI, or less of physical activities, then the menopause affects them differently. So the individual factors, the overall health of a female, the history of her medical condition, whether she has diabetes or anything, and her personal experiences, what she's going through at that time, when the hormones come down in her body, they definitely influence her life. And that is how that can influence of how the woman acts at the time of menopause.
Interesting.
Does it answer your question?
Yeah.
Yeah. It's very nice.
Okay.
Yeah.
Yeah. So,
Okay,
is there
dear.
a way to predict when menopause will happen for a person?
Okay, now this menopause, as I told you earlier, it is an age, it comes between 45 to 55 age. Okay.
Hmm.
In our Indian counterparts, we have a little earlier. So there is nothing called we can predict menopause. We cannot predict menopause, but the female goes through the changes, we can know. Like, like what happens, she starts to have the irregular cycles. This menopause comes in different ways. Some people, it will immediately stop and the cycle don't come completely, and after, it is a retrospective diagnosis, means you can't tell that got menopause only
Hmm.
when 12 months of no cycle, yes, you know you have menopause. Okay, some people will suddenly stop the cycles and they won't have periods, and after 12 months they will realize that my cycle did not come 12 months back. Some will have regular cycles, but the amount of bleeding will be less. The amount of bleeding will be very minimal, slowly it will come down, 3 days to 1 day to 1 day, like that. And some people will have, the amount of bleeding will be normal, but they'll get in 2 months time, then 3 months, then 6 months, and finally it will come. So we cannot menopause predict, but we can know at what age your mother got, what age your sister got. So we'll get a rough idea. The genetic predisposition is there. There is
Hmm.
lot of studies to know, but it is like mother daughter pair. Yes, my mother got at this age, so I will get at this age. But that doesn't hold 100%. All right, because your life may be influenced by so many other factors, but it
Hmm.
influences around 44 to 55%. You can predict it. And family history, then the lifestyle, smoking. Suppose anybody is smoking, then they had turned to have an earlier menopause because the ovaries are destroyed by the smoking. But yes, you can predict it by doing a hormone level when you are getting these changes around menopause. That is around the 40-45 age group. If you are getting the cycle changes and all, you can do a test called the follicular stimulating hormone test, and the estradiol level, that is the estrogen level in your body. And this will help us to predict, like, this value, if it goes more than 20, yes, we are going to get menopause in around a period of 1 year. But as such, we cannot predict the exact date of menopause.
Yeah.
So, doctor, do you suggest that that means around above 40, if somebody is having irregular periods or menstrual cycle, then they should visit a doctor to,
Yeah, yeah,
I mean,
yeah.
to know whether it's
Yeah, they
related
should.
to menopause or something else.
No, it is better if she gets heavy periods. Like, if you have got regular cycles, the amount of bleeding is less, you are getting irritability, mood disturbances, yeah. But always better to see a doctor. But if you get heavy cycles, because menopause means it is coming down, the hormones coming down. But if you have heavy cycles, don't take it as menopause. Some people, they'll come back after 6 months with a hemoglobin of 6 grams and tell, doctor, my neighbor told, my friend told that it is menopause because I'm having heavy bleeding. Heavy bleeding should not be taken. It can be related to fibroid, it can be related to adenomyosis, so many medical and gynecological conditions. It is better to see whenever you have a change in your pattern of cycle, always go and consult the doctor.
Right.
Okay.
Yeah.
Interesting.
Yeah.
So,
Interesting.
so I think, we keep hearing these terms, perimenopause, menopause, postmenopause. So, is there something quite remarkably different between these terms, and what do they mean actually?
See, now, as I told you, the first cycle in a female cycle is called menarche. The menarche means first cycle.
Right.
Menopause means last cycle.
Yeah.
So between menarche to menopause, our if our the reproductive period is divided into 4 stages of reproductive aging we have. So we have got the reproductive period, we have got the perimenopause, which you told, or the menopausal transition, which we call. Then we have the menopause, and then we have the postmenopause. Now, this reproductive period is the late, it is divided into early reproductive period when we have the children and all that, and it is called the late reproductive period. Now, during that late reproductive period, your cycles will come very fast. You understand? So our female will come to us, doctor, I got my cycle every 28 days. Now, why am I getting it every 22 days, 21 days? So that is a phase of late reproductive cycle. Though they will not conceive, but it is very fast. And this precedes the perimenopause. Okay, this perimenopausal or menopausal transition occurs 2 to 4 years or 2 to 8 years before the menopause. Now, this perimenopause is the phase where again the cycles become very irregular. She misses her cycle, relating to prolonged cycle and sometimes heavy bleeding. So that is a few years of perimenopause, and before the FMP comes, that is the final menstrual cycle comes. When the final menstrual cycle comes, 12 years from there is called the menopause. You understood? So the final menstrual cycle is the last cycle when you get. From there, 12 years, 12 months ahead is called menopause. After that, it is called menopause. That phase is 12 months later is called menopause. Now, after menopause, there is something called postmenopause. Now, this postmenopause is again divided into early postmenopause and late postmenopause. So, early postmenopause lasts around 4 to 5 years after menopause because the symptoms are similar to that of the perimenopause or the symptoms before the menopause. So, it's like a fulcrum. The middle portion is the last menstrual cycle, 12 years later, menopause. 4 years before, 4 years after is perimenopause and postmenopausal. And postmenopausal can be early, that is the 4 years later, and after that is the late postmenopausal. So this in another word is there. It is called climacteric. So climacteric is a word which is 4 years before and after the final menstrual cycle. So that is how we define it in the medical terms.
Okay.
So I just have one simple question. Namrata and I both had partial hysterectomies, and so no periods after that. So how does that determine? How does that affect your menopause or postmenopause or whatever?
Yeah. If you have a hysterectomy, okay. So it depends upon if the lady is less than 45 and she's got no family history of any ovarian tumors, we usually leave the ovaries back. Okay. So if you have had your uterus as well as the ovaries removed, then you have got something called surgical menopause. It is that the same day is menopause comes to you. The 12 months period is not allowed. Like it is immediate, abrupt menopause. It is. So you tend to have the postmenopausal symptoms in a very harsh way. Okay. But if you leave the ovaries back, it comes a little slower. It comes a little slower than the surgical menopause with ovaries removed. But definitely, the natural menopause is the menopause which most of the ladies undergo without the hysterectomy.
So if you have a hysterectomy, then are you saying that if I would have normally had my menopause at 52, and I had a hysterectomy at 47, then will that period be decreased?
Yeah. You have got menopause there only. Your hormones have stopped immediately.
No,
So
if
that
I have
phase,
my
that is.
ovary, if I have my ovaries intact, then
Yeah, but ovaries don't function well after hysterectomy. The
Ah,
blood supply comes from the both the ovarian vessel as well as the uterine vessel. So they usually disappear by 2 years. They won't stay as for another 5 years or something.
acha. Okay.
Yeah.
Doctor, like some of the complaints you covered, like, but what are the some of the most common complaints associated with menopause?
See, the most common complaint and which is the most irritating complaint for a female during menopause is hot flushes. Hot flushes or night sweats. Suddenly, the female feels a feeling of warmth that spreads all through her body. And she starts feeling hot. She'll be sitting in an AC room. Everybody will be sitting in the AC room. Everybody will be feeling cold. But that lady will suddenly feel a warmth and then sweating starts. So, that is the most distressing and the most common symptom of menopause. Apart from that, there are a lot of symptoms there. She can have the changes in the menstrual cycle, irregular periods, vaginal dryness. This vaginal dryness becomes because of the vaginal tissues become thinner because of the lack of estrogen, and she usually the patient will not complain of it, but they have discomfort during sex. Okay, they'll have difficulty in sleeping, insomnia, lack of sleep, because it can be because of hormonal changes also, but it can also be because of the night sweat. Suddenly in the middle of the night she feels hot and sweating, and she has to get up and put on the AC or go out somewhere. So these symptoms can come. Swings are very common. Irritability, anger, depression, anxiety. So these are all very common during menopause. Apart from that, she has difficulty in remembering names. Like, I'm seeing you today, Ali. Tomorrow I will see you. I'll talk to you full day. Then I will not get that name. You have turned and gone away, and I'm not remembering your name to call you back. So these problems really occur, and they can be so distressing. I
We know
can't tell
that very
you.
well, I think.
Yeah,
We
those
can
and
identify with
suddenly,
those.
yeah, and
But
suddenly,
Dr. Priya, how do you know कि it's because of menopause or it's because of old age? How to distinguish that?
see, not like that. Menopause, as I told you, is the final cycle. Okay, it's postmenopausal,
Okay.
so that can occur. Old age is also postmenopause, though now we are living longer after the menopause. Our life expectancies are increased. So
True.
our peak of a career, that is peak of a career, most of the female reach around menopause, right? So peak of the career are covered after 30 years of that. So now age is just a number. Even a 70-year-old has got good memory and everything. So we can't tell that. Apart from that, there are difficulty in concentrating, forgetfulness is there, and joint pain, muscle cramps, and even the urinary symptoms. You tend to have urgency. You feel like passing urine, you want to go out somewhere, you will tell, can I use the restroom and go? You will use the restroom and go again. When you have delayed the work, again you feel, okay, let me go to the restroom. This urgency frequency is there, and you will confuse with a urinary infection, go and do a urine culture repeatedly, and it comes negative. It is all because of the lack of estrogen. The That is called atrophic vaginitis, and irritation is there. So that is also a common symptom with menopause.
So does pigmentation also occur? Because I have got some symptoms. So I was thinking that it was due to menopause. Does it happen or not?
It can happen because of menopause also, because of the testosterone level and all that, but
Mm.
it can also be related to your pregnancy and childbirth which has come. All the skin pigmentation are all related to menopause. You'll get skin changes, atrophic changes to the skin, because estrogen is related to the epithelium. So
Okay.
all over the body, the epithelium is the outer layer of the skin. So
Skin.
when you get dryness, so skin dryness will come, pigmentation will come. This is because the blood supply is less, the body is not able to clear that area. So that is all related to menopause. It's
Yeah.
quite common to get skin problems during menopause.
I think you spoke about, forgetfulness and brain fog. So are these like it's just a phase, or do these changes last for a long time?
See, what we have to do is, it's for some people it will be there for a long time. For some people, they get over it very fast. So
Okay.
at that time, we have to do brain exercises, like learn new hobbies, do new puzzles. You understand? So
Mhm.
try to solve some things, try to do some brain exercises, and most of it we come out of it. But again, the old age comes, Alzheimer's come, again forgetfulness comes. So
Hmm.
you have to make an effort. You have to learn new things, new books, read new books, talk to friends, and I think you are doing efficiently all the new things. So it should not be a problem to you. Yeah.
So apart from these
Okay.
brain exercises, are there any physical exercises that we are supposed to do?
Yeah, everybody thinks, like our grandmothers and mothers think, okay, I've got menopause means I should not walk, I should just be in one place. I'm old. It is not like that. You have to do exercise. And exercise is very, very important during menopause, because maintaining the bone health and managing the energy levels, you need a lot of energy. So we have to do a lot of exercises, and especially the weight bearing exercises, strength training exercises, balance training exercises, cardiovascular exercises. Now, cardiovascular exercises means you require the heart. The incidence of heart diseases or is lesser in the premenopausal age group. In the female doesn't have a stroke when she's young, but
Yeah.
compared to the men. But after menopause, it equals that. Okay. So for the heart, we need to do a lot of walking, jogging, cycling, and that improves our cardiovascular, the pumping of the heart and all that, good for the heart diseases. Now for the Regarding the strength training exercises, bones, for the bones, we have to do weight bearing exercises. They stimulate the bone formation and help to maintain the bone strength. For the muscles, muscle wasting occurs because estrogen is not there. So our muscles, which you could feel, that nice tight muscles you have, suddenly your body becomes loose. Okay, for the muscles also, you need to do nice strengthening exercises, resistance exercise, like hitting the wall and giving yourself a nice push-ups and all that is very, very important for us. So exercise improves even they reduce the fatigue, which is also common in menopause. You tend to have, it also helps to improve your mental, it reduces the mental stress for you, depression and everything. Also the quality of life. And while sleeping, you can get good sleep when you are tired. So all these are very important. But always remember, when you are trying to do any exercise, you should know about your underlying health problems, whether you have a diabetes, hypertension, cardiac disease. So better to consult your doctor before you start exercising on the YouTube, yoga exercises, this exercises, and be little slow. You don't do it immediately. Like what you did, you have never done exercise and somebody has told you menopause, you should do exercise. Don't start
Right.
immediately the next day. You understand that many people get influenced and start doing lot of exercises, have muscle tear and everything, and come to us. So it is always better to start exercise regularly, start slow, low intensity workouts, gradually increase in duration, intensity as you get fitter and fitter. It's not that we cannot get fitter after menopause. Yes, what your energy level can be higher than what it was before menopause. It just requires a little bit of more training and more consistency in your workouts and everything, and take breaks when needed. And of course, you should always remember about hydration. So we don't feel thirsty during menopause. So we should always drink plenty of fluids, both before, during, and even after the exercises. Keep yourself hydrated. That is also very, very important part of exercise.
So, Dr. Preet, do you suggest that even during menopause, suppose we are putting on weight, so in the long run, there's a possibility that we can also shed some weight but by
Weight actually, yeah,
doing the
yeah,
proper
yeah.
exercises?
Yeah, and eating the right amount. See what happens at
Yes, right, right.
BMI come downs. Okay, we have
Mm.
craziness for eating for a lot of sweets and food and all that. So we tend to eat more, and the requirement in our body is less because our cells are not regenerating as in a young person who grows very fast. So our requirement is less. So we have to control our food apart from doing the exercises. And it is not the fat which is the problem; it is the tone which is very important. The tone comes down, the muscles and all are very weak, so we have to do the toning exercises. Of course you can reduce weight, it is not like that at all. but it requires lot of effort.
Right, right.
Yeah,
That's
yeah,
so.
yeah.
To ask, does autoimmune get triggered or maybe aggravated during menopause?
Yeah, that is again a very difficult question. Yes, it triggers during menopause. It definitely autoimmune causes a problem during menopause. But then again, you have to go to your local doctor who can change the tablets and the doses and try to help you out in that.
Mm. And on the same note or on a different note, actually, what's the impact of menopause on mental health and maybe a loss of self-esteem for women?
Yeah, the what happens when menopause comes? It is not the menopause which causes the problem. It is the perimenopausal. That is the few years before the menopause. That is the time when the female undergoes lot of mental trauma and loss of self-esteem. It affects the hormones and risk of depression, anxiety, hormonal fluctuations are going on in your body, and suddenly the life transitions are also there. Midlife crisis, that is called. So that is the time you are in your peak of your career, your children are moving out, they are studying hard, plus your body hormones are high. So it causes lot of mental swings and all that, and the self esteem also goes down. So many female, they experience anxiety, nervousness, panic attacks, but they are not able to know why, because they are not able to remember things, they are not able to plan things well. Forgetfulness is there, concentration is there, brain fogging is there. So this all can actually cause you a lot of loss of self esteem, and you have not slept well, you're getting the night sweats at night.
Right,
Okay,
right.
insomnia is there, so again your whole day you feel full groggy and all that.
Mm.
Career is high, family relationships are very important, significant events occur at that. So they all causes a lot of stress and mental challenges. But of
Mm.
course, it is very important regular exercise, healthy diet, stress reduction techniques, they can all improve your mood and help in the overall well-being. And of course, if the person is facing through a lot, they can go to the doctor or a gynecologist. We can help them with some menopausal hormone therapy, and they can come out of it very well. And of course, self-care is very important here. You have to prioritize your sleep and what way you can relax. What some people like to relax by listening to music, some relax by listening to by going to listen, by reading books. So you have to improve on your relaxation techniques and prioritize and always do the things which you enjoy. You understand, the self care is very important at this phase to overcome the self esteem and the mental health, depression, and all that. So these are very, very important. We lack at this time because we are busy with our career, we are busy with our children, we are busy with this. So we don't have time for ourselves. So
Mm.
this is how the mental stress comes in a very big way. We are not able to know what to do, very confused, the body hormones changing. Okay, but it doesn't happen to everybody, but whoever it happens, they go through a lot at this part of life.
Okay, Dr. Preet, like, do you really feel that during this period, the family support, or the people around the person, if they are educated or if they are supportive, that's going to help the person a lot? Or how do you bring awareness in the family that
Yeah, that is very important. Previously, we had joint families. The female did not have time alone. She did not have time alone and she was busy with other things. You would have seen your grandmothers never complaining of menopause. We never
right,
knew whether a grandmother what is menopause, when she stopped the periods, nothing. But we saw our parents, our mothers going through it. So family support is very important, and we are lucky to be Indians because we have so much family support. West, everybody stays alone and they go through a lot and they keep on visiting the doctors and they have lot of problem. Here, the family support, the husband should be counseled, the daughter or son should know. The family members should also know about menopause, what it is, and the women should have an open communication. She should tell them, like, look, I am having this problem, and they should understand it and give them some physical assistance. And so many times they should listen to the female concern, encourage her, help her in a daily task to elevate the burden of symptoms for her, because the daily routine which she is doing for her, like she's household activities and all, the family can help her, and they should be aware of her mood disturbances. Look, my mother is going to get angry, she's so irritable at this time. Okay, that is quite normal, but she doesn't mean us, she doesn't mean anything bad. So that should be told to the children, the husband. They're all there. And of course, active listening to the female's concern, what she wants to share. People will tell her, leave it, you don't tell. They just ignore that female of the house. That should not be done. She should be a part of every what do you call, every important decision we are taking. Because she's attaining menopause, she's losing her mental strength, she's not able to remember so many things, doesn't mean that you should take her out. So by providing a supportive and understanding environment, of course family can help the woman to navigate the menopause in a very good way and maintain their mental and physical emotional well-being for this life thing. That definitely family is very, very important. So whenever we get patients who come and tell that I'm going through this, always we call the husband and the mother and the daughter or son and give them a little bit of insight into what the mother is facing. She may not be comfortable enough to tell them, and then counsel them and undergo, and thus they are able to overcome this part of life in a very good way with the family support.
um, okay, Dr. Preet, does the sugar cravings increase during menopause?
Yeah. Sugar craving is very, very common during menopause. Food and sugar craving, they can be quite intense at time. You cannot control it. You want to eat lot of sweets, and people mistake it as diabetes. They probably you're having diabetes, but it is not like that. The cravings is almost linked to the hormonal changes during the menopause transition and can persist post menopause. But however, they can eventually tend to subside as the body gets used to the new hormones. It will subside. So it is
Oh,
quite common to have sugar craving in
So
menopause.
this lasts for how many years?
See, menopause we can't tell. Some people it will last for 1 or 2 years, some for 2 to 3 years. There is no definite time limit for the anything in menopause.
So,
So
like,
I
there is
think
no
she
time limit. Yeah.
I'm
she was
very
asking
happy.
about the sugar craving.
Sugar craving.
Yeah, same thing as because there is no time limit, as I told you. Some people will have 3 years, 4 years down the lane. Some people within 1 year will just try to maintain it and it craving goes away. It
It
is
Yeah.
can
how
remain
your
for a
body
lifetime.
hormones.
It can remain for a lifetime.
I'm not sure about it.
That's just you and me, Namrata. That's not due to menopause.
That is not related to menopause, I feel. It is more than that.
Is there something called male menopause?
Yeah, it is otherwise known as andropause. Okay, male menopause is otherwise known as andropause, and in that, what happens? It is similar to that of female. There is a gradual decline in the hormone called testosterone. We have estrogen, so male has testosterone. So there is a decline in the hormone called testosterone that can lead to various physical and emotional changes in the female. Okay, in the male, similar to that of that experience during menopause. So what happens? They get the men will be working very hard, and suddenly they see that, oh, like I cannot lift this, I cannot do this. They will suddenly realize that their fatigueness is there, and decreased sex drive is there, erectile dysfunction is there, mood changes are there, they'll have depression and difficulty in concentrating in their work. So they even gain weight at some time. At this time they will not be eating so much, but they'll gain weight, and there's reduce in the muscle mass and increase in the body fat mass. So this is called andropause. This is counteract of that of menopause in female. Similar to the menopause, they have to do regular exercise, balanced diet, and stress management, and they can overcome the symptoms similar to that of menopause.
Okay, that's so. Another question, Dr. Preet. Say after menopause, somebody is there after 3, 4 years, we are getting again bleeding. So, what should we do? Should go to the
See,
doctor?
any bleeding, doesn't matter about the amount, even if it is a slight spotting, after 12 months of the final
Mm,
menstrual period, should be
mm,
consulted to the doctor. You should immediately go. That is a warning symptom because CA endometrium has come in a very big way. Okay, when we were studying PG 30, 40 years back, we saw only one case of carcinoma of the endometrium, but now it is very much increased.
yes, yeah.
Though it may not be anything, it may be atrophic vaginitis, that is dryness of the vagina would have caused it. That is the most common cause of postmenopausal bleeding. Okay,
Mm,
that after 1 year of menopause, if you get bleeding, don't take it lightly. Even if it is one spot, always visit the doctor. It should not be taken. It can be a small polyp in the endometrium. It can be an ovarian tumor. It can be anything. Though the malignancy constitutes only 20 to 30% of the cases of postmenopausal bleeding, mainly it is non-malignant condition. Like you've forgotten a copper inside for a long time. Some vagina trauma would have occurred because it is a thin vagina, okay, dry vagina, but still you have to go to the doctor. So don't take it lightly. It is a
So,
warning
any
symptom.
regular uterus checkup or health checkup you suggest for
Yeah,
this?
yeah, yeah. Master health checkup. Now, what do you call by women's health checkup? Master health checkup, the whole idea of having a master health checkup is to know the symptoms or know the problems before they come. So
Hmm.
when you have a routine screening of your body, see, we are so busy in our day-to-day activity that we are not able to know the warning symptoms that our body is giving us. Like, look, you are lacking this, you should go to the doctor. So it is better to do an annual master health checkup for every female, and especially after the menopause. We have to do mammograms. Mammogram is cancer of the breast. Cancer of the breast has come in a very big way. When 30 years down the lane, cancer of the uterus, that is cervical cancer, was more common. But with the primary prevention, secondary prevention, Gardasil vaccine, and all that, it has come on a decline, and cancer of the breast has come number one, similar to that of the Western. So we should have yearly mammogram, at least 2 yearly mammogram. And if you have a distant relative or a own family member having any cancer, either of the ovary or the breast or the colon cancer, you should have regular checkups. Pap smears. It's not that menopause has come, I cannot get cervical cancer. You can do pap smear up to the age of 65. So regular master cholesterol level. You understand, before menopause, we have the estrogen. So the HDL level is very high. But after menopause, the HDL goes down because of the lack of the estrogen. So cholesterol goes up. The good cholesterol comes down. The bad cholesterol goes up. So you tend to have heart problems, cardiac problems, and all that. So cholesterol checkup, pap smears, mammograms, apart from your sugar, blood pressure checkup, are very, very important in the menopausal age group. You
So
should not
Thank you.
miss on that.
yeah, so basically
Miss on that.
menopause
Really insightful.
affects your entire system. I mean, the entire all the organs of the body, right?
Mm.
Everything.
Yeah, from the mental health down to the bone health, down to the uterus, the vagina, everywhere, everywhere.
And
Yeah,
then, Namrata, it's very important that we women, at least, we understand our body and we are kind to ourselves.
yeah. Self
We,
care is
you know,
very, very
we just,
important.
yeah, we just rest, we listen to our body and be kind to ourselves. That's very
Yeah,
important.
yes,
Yeah.
yes, yes.
Dr. Preet, any final words on how to manage menopause effectively and in a very healthy way?
Menopause is just normal. It is a normal, natural cessation of menstruation. So we can all manage it very well by doing regular exercise, eating diet, good healthy diet, low carbs, less oily fatty food, lot of fruits and vegetables in our diet. The plate should look colorful. It should not look like the same yellow, white, and all. You should have variety of vegetables, variety of fruits. Go for regular exercises, walking, and the mood swings and the disturbances which we have to accept it like it is there. The loss of memory which is there, we should accept it. Yes, it is there. So we should have other methods to improve, like doing some puzzles and exercises, going into new hobbies, new things, meeting people. Staying alone also leads you to a lot of depression. So having new friends, acquiring new habits, and everything, I think we can all go through menopause in a very easy and simple way.
So this was such an insightful conversation. Thank you, Dr. Preet, for shedding light on this important topic and helping us navigate menopause with clarity and with confidence. Thank you so much.
Thank
Thank
you.
you, dear. Thank you so much. Thank you so much for the
So that
opportunity.
Yeah, it's a pleasure. So if this episode made you smile, gave you some insight, or just made you feel seen, let us know. Drop a comment, share your thoughts, or tell us about your own menopause journey.
and if we are experiencing menopause, just remember you are not alone. We all are in this together.
Absolutely. And don't
Absolutely.
forget to like, share, and subscribe to our channel. Your support keeps us going and helps us bring more meaningful conversations to life. Until next time, stay strong, stay fabulous, and keep trekking through life. Thank you so
Bye
much.
bye.
Bye bye.
Thank you.